In this video, we'll discuss about histology of serous type of salivary gland, parotid gland. The parotid gland is a serous type of salivary gland. What is mean by serous and mucous gland? Salivary gland because of presence of acini, which are serous or mucous type. If a gland containing only serous type of acini. These are called as serous type of salivary gland. If that salivary gland that contain only mucous type of acini, then they are called as mucous type of salivary gland. If the gland containing both serous as well as mucous acini, then they are called as mixed type of salivary gland. So the parotid gland is an example of serous type of salivary gland, whereas the example of mucous type of salivary gland, mucous type of salivary gland, example sublingual gland. The mixed type of salivary gland, both serous and mucous, example submandibular gland. So that parotid gland contain only serous type of acini. It have that name serous type of salivary gland. Example parotid gland. If that gland containing only mucous type of acini, so it is called mucous type of salivary gland. Example sublingual gland. If that gland containing both serous as well as mucous type of acini, it have that name mixed type. Example submandibular gland. Now learn about what is acini. Serous acini. That serous gland which are triangle. This one is the triangle in shape. The cells are triangle in shape. So these cells are rounded in shape. They lies at the base, okay, where it is presented on that base. The cell boundaries are indistinct. Indistinct means not clearly marked, and they contain here they containing zymogen and granules. The serous is always darkly stained. When you see this microscope, this one are always darkly stained under microscope, because presence of this zymogen and granules, that reason only darkly stained, and that granules they secreted thin watery secretion. So this one serous acini, triangular shape containing rounded nucleus at the base, then cell boundaries are indistinct, not clearly marked. After that it containing zymos and granules, zymogens. That reason only they darked stained. Under microscope they secrete watery secretion. Next one is mucous acini. Mucous acini containing the cells or flatted cells. See here, these one are the flatted cells, flatted nucleus that lies at that base. This one also presented in the base, but a flatted one. Okay, here this one is the flatted nucleus that also lies in that base. So the nucleus lies at the base of that triangular cells. Then their cells boundaries are distinct. Clear way it is presented, and that mucous acini containing mucoid material. It containing mucoid material, and they appear lightly staining. Okay, light staining. They appear in empty in that hematoxylin eosin staining, appear empty in hematoxylin and eosin staining. They secrete thick mucoid secretion. Thick mucoid secretion. Example, we can note many of these mucous acini or that sublingual gland. Sublingual gland. So what are the serous and mucous acini? Serous acini are triangular type of the cell which have rounded type of nucleus at the base. They cell boundaries are indistinct. They containing cymogen cells. Okay, cymogen cells or cymogen granules. They containing cymos and granules. That's why they staining dark color in hematoxylin eosin staining. They produce the thick watery secretion. For example of this gland, parotid gland, which we want to discuss now. And that mucous acini or mucoid cell which have a triangular shape of that cell, their nucleus lie at that base, which are flat in shape. They produce the thick mucoid secretion and they are sublingual gland. Now coming to this diagram. A histology of parotid gland. The parotid gland is the serous type. Okay, this one is the serous type of acini. Serous type of salivary gland. We already said this one. So throughout this gland, serous this one serous type of acini are present. So we noted that the serous acini darkly stained due to presence of cymogen granules. They are basophilic. Why these one stained? Because of they are basophilic, intercalated and striated duct are seen. Intralobular duct are seen. So here, here uh, intralobular duct. Okay, here also intralobular duct also presented. So this intralobular duct are intercalated and striated. This one is seen in interlobular duct. So this one is the interlobular duct. This one is the interlobular duct. Okay, this one. Thus intralobular duct is the striated one. So this one is the intralobular duct. Okay, cells are small, so the duct are cells are small, so the duct are striated duct, which has triangular cells. We can note the presence of adipocyte here. So here we can find out adipocytes also. Then blood vessels also. This one is the connective tissue septa. This one is the connective tissue septa. So serous acini cymogen granules is presented, that reason only darkly staining. This one having adipocytes and blood vessels. Then this one is the intralobular one. This one is the striated duct and intercalated one. This one is the okay, interlobular duct presented in that connective tissue septa. Interlobular. Intralobular is presented in that serous acini. These are the things full serous acini only. So this is all about histology of serous type of salivary gland. So histology of serous salivary gland. Serous type of acini example parotid gland. Mucous type example sublingual. Both examples of mandibular. What are the acini? Serous acini. What are the characteristic feature? Dark under microscopy. Then mucous acini. Flatted nucleus. This one light staining. Diagram. Intralobular duct, striated duct because smaller one. Then interlobular duct, intralobular duct within that serous acini. So connective tissue divided gland into that lobules. Thanks for watching.